So just a reminder to everyone that this presentation is recorded, as are all of the UK-ICN webinars, and that they'll go up on the UK-ICN YouTube channel if anyone wants to watch back or share those links with colleagues. Also, another reminder about the AGM for UK-ICN, which is hosted by the University of Edinburgh at the Roslin Institute on September 17th and 18th. So hopefully you'll all be attending that, especially those people I see online who are based in Scotland. I don't know, Lukas, if you're happy to proceed without Katie, and then I know we discussed just offline there, maybe having 7 minutes, but you might have to extend that out a little bit if Katie's not there, and by the end of that. But if I can hand the floor to you for the sort of brief introduction, and then we can hopefully Katie can come online, and then we can get the discussion started around 20 past, half past, if that's okay with you.
That sounds good to me. Great. Well, thank you very much for inviting me to do a second installment of the discussion we had last year, also with Katie and then also with Lisa Bowden, who unfortunately couldn't make it today. And I discussed a bit with Katie what we could do today and how we might structure this discussion today. And hopefully she'll join us any second now. She's struggling with a bit of technical issues. But we thought that my input should focus on the question of history and why and how and to what end history might be important for epidemiology. I'll keep this very short, and it's more like a kind of a spotlight on a few issues that I engage with in my work. Just a brief kind of reminders, so I'm speaking from the perspective of leading a large ERC-funded project on the history of modern epidemiological reasoning. That is the history of how epidemiology became a science and how epidemiology is still trying to become a science up until today, and how the epidemic disease became an issue of concern in the landscape of modern medical sciences, social sciences, and so on. And so in this work, of course, COVID-19 is not just kind of an instance, but is also a prompt in many ways to think about this history, to think about the history, especially in the 20th century, of how epidemiology has developed into what it is today and what it is becoming in the near future. One issue that I am in particular focusing on is that we see epidemiology developing since the middle of the 20th century increasingly as a kind of ahistorical science, or as an ahistorical endeavor. What do I mean with that? On the one hand, there is a strong focus on modeling that I think we all are aware of to some extent, that the compartmental but also statistical modeling is a way to engage with epidemics so that certain indicators can be taken, put into various kinds of models and modeled procedures and algorithms and so on, to then make some kind of predictions about the present, some kind of predictions perhaps also about the future, and to then develop some kind of account of how we can think about the epidemic as something that is happening right now. We all seen this in COVID. We've seen this in COVID, I think, to a large extent, but also to then engage with the epidemic as one that is both virtually accessible through the model, but at the same time then also develop policy advice and policy engagement through the model that then can be applied to the epidemic or to the raging pandemic, as we've seen again in COVID. At the same time, COVID has ushered in the age of dashboards, devices and tools to have a spectacle, as I called it in some place, of a real-time epidemiology. I call this a spectacle because it is a highly sophisticated and quite interesting a set of procedures and set of practice that are required to develop and to invoke the sense of kind of accurate numbers that are changing minute by minute, to provide a sense of a kind of functioning and omniscience measurement and omniscience accounting and surveillance of an epidemic while it is ongoing. And that is clearly one thing that has kind of shifted the experience of this pandemic, COVID-19, vastly away from the experiences or from the kind of representation or from the kind of communication, both the scientific and the public communication of epidemics and pandemics in the recent, but also, of course, in the longer past. Never nearly have we kind of like been so much in the present of the pandemic while it was happening and have the kind of this kind of experience of seeing epidemic as something that is happening right now in its full extent through these dashboards. There's a risk, I think, both with regards to modeling and with regards to the dashboards for epidemiology to lose what I phrase or what I call its historical consciousness. What do I mean with that? One thing is kind of like, it's first of all, it's just the thinking about what history provides for epidemiology. And there, first of all, to go beyond thinking of history as just a prepackaged reservoir, as a prepackaged archive of lessons that can be used, that can be loaded into the model, that can be taken as almost as kind of like a set of data sets that we find from the past, from each different epidemic and pandemic in the past, that there lies some data sets ready to be used as training data or ready to be used as examples of kind of like settled cases, and to bring them in to then train a model for the current crisis is something that we've seen a lot in COVID, and I think there's a fundamental problem with that, and that basically boils down to that none of these data sets are that clear cut. None of these histories are settled histories. All of these histories have an enormous amount of controversy, an enormous amount of kind of ambiguity to them that often gets lost in that kind of demand for history to be like just clear-cut lessons or clear-cut archives that are useful for our ongoing problem. Instead, I think what is required and what a historical consciousness would bring is to think of the history of epidemics as a set of challenges to the economic, social, cultural, and political systems of the past. Epidemics, and I think some historians have made this quite popular the case, or quite forceful and powerful the case, that historical epidemics are lenses through which we can understand the history of a range of factors, economic, social, cultural, and political history much better. But it is also a history, and I think that's where this project and my work comes in. It's also a history where epidemiology is best advised to understand its own position in the past, is to understand the shifting status of epidemiological expertise, a history that has always been a history of perceived crisis. The epidemiologist has never been listened to in peacetime and has been kind of perhaps been equipped with too much authority in certain crises. But it's that kind of history of developing a better understanding, or that kind of understanding of that better understanding of the history of how epidemiological expertise became what it is today. One spotlight that I thought I would point out is this kind of beginning in the early 1980s, but actually here was this publication in 1979 of a chapter that kind of one could say is a bit of the beginning of infectious disease modeling as a particular pronounced field within epidemiology that has gained more and more authority over what epidemiology does and what epidemiology is known to be doing. By no means saying that this is all of what epidemiology is or has become, but this is with no doubt one of the most influential papers in epidemiology and beyond, written by Roy Anderson and Robert May in 1979 on population biology of infectious diseases, and where I think it's quite interesting that throughout this paper, the one figure that they are particularly pushing to the backwaters and that they're particularly using as a form of contrasting their own perspective from is the figure of the natural historian. And to say like the natural historian is actually a problematic figure in epidemiology, according to Roy Anderson and Robert May, because it only has brought about an arcane literature that is dedicated to specific diseases, that is overly concerned in their mind with the recondite biological details that make each parasitic infection unique, that has too long grappled with kind of specific unique diseases, and their their requirements and their specific dynamics, but it stands, the natural history approach in epidemiology, so Roy Anderson and Robert May argued quite powerfully, stands in the way of developing a unified framework through which epidemics can be understood in different ways, through which epidemics can be understood as part of a large-scale system that can be computationally assessed. Again, reminder here, 1979, also the time where those computational practices and computational facilities became available to do so. And I would just want to throw this out, kind of like this beginning of population biology or infectious disease modeling as a moment where that conflict between infectious disease modeling and natural history is becoming most pronounced, and where we see a certain development in the history of epidemiology towards modeling and away from a historical approach, and therefore kind of in a direction where historical consciousness became very difficult to sustain. So to sum up, my point is a bit, why should we bother? Why should epidemiology bother with having a historical consciousness? It's first of all to reflect on how we use the past. It's to reflect on how the past comes to echo in our present and how we have to kind of engage with the past in different ways. And that can be a very open-ended conversation about the different utilities and the different problems that might be involved in different kinds of engaging with the past. Thinking here of the data scientist who has a very different understanding, a very different approach to data sets that reflect past events than the historians might have. But there is no moral value here. There is first and foremost a necessity to reflect on what these different usages of the past bring and how the past is being invoked in these different sets of engagement with the past. It's also important to have historical consciousness in epidemiology to understand how the field orients itself in time and how it is bounded by its historical context. Where did epidemiology come from? How did epidemiology assume the kind of authority that it held at times and in some kinds of settings? But also, what is the historical, and in that way also what is the geographical context in which that kind of authority is bounded and enabled and established? How might the experience of the UK be very specific with its very pronounced school of infectious disease modeler from, for example, the history of Brazil with a very deep tradition of social epidemiology established in and around the Fiocruz. And finally, and I think that's my main point that I want to kind of emphasize, is historical consciousness is important for epidemiology to remain and to understand its position as an agent of history and of change. And I think losing historical consciousness is mostly associated with the risk of becoming a kind of a field that is too much dedicated to maintaining the status quo, finding technical solution, engaging in kind of like analysis and in approaches that sees epidemic crisis as something that disrupts the status quo and therefore need to wield technical instruments to contain those pandemics, but is giving in and is giving up to its kind of more social conscious at that point, also to be a kind of agent of change with regards to equity, health equity, globally and locally. Thank you very much. I think Katie is now in, and I think I'll hand over to her if that works fine.
Thanks, Lukas. Very, very interesting. So we're going to have lots of questions and discussion about that in a minute. But Katie, you mind just sharing if you've got any slides?
Okay, well, thank you so much for the invitation to speak this morning. So for those who haven't met me before, my name is Katie Adam. I'm a lecturer in innovation in the life sciences at the University of Edinburgh. So I work between the School of Veterinary Medicine and the Faculty of Social and Political Science. With my other hat on, I'm also a member of EPIC. So we're the Scottish Government Centre of Expertise on Animal Disease Outbreaks. We're a consortium of scientists around Scotland who provide policy relevant advice on animal health and animal disease control. So today I wanted to speak a little bit about communicating across boundaries, and these kind of, by boundaries, I mean any kind of communication barrier, any gap, whether that's organizational, whether that's disciplinary, whether it's national, whatever it may be, but something that comes in the way of effective communication between different groups. So this is something that I both research and practice. I wanted to give a little bit of an insight and perhaps lead into a bit of a discussion around this topic. So as I say, I think we would all agree that effective communication is absolutely crucial to be able to prepare and respond to disease outbreaks, whether that's at a local level, a national level, or we're talking a global pandemic. And what I wanted to focus on today is identifying those potential boundaries. Where do those barriers come in? Where do they exist? Why do they exist? So I'm going to look at this in three contexts specifically, being research, working at the science policy interface, and also within the One Health context, so working between human, animal, and environmental health. From the research side, I've borrowed a diagram here that I think sums up many of these challenges quite nicely. So as we all know, working in the area of disease control, of pandemic preparedness, we draw from a multitude of scientific disciplines across the natural, the social sciences. And the way that we do this, there are inevitably disciplinary boundaries when we attempt to do this. So when we talk about interdisciplinary work, I think we often use that term quite in an all-encompassing way. And often what we really mean probably is more of a multidisciplinary approach, that we have different disciplines all working together to address this core problem and to try and find a solution. And this the proposal, this kind of framework is saying that we're seeking greater integration. So interdisciplinarity being more of a coming together to create new disciplines or new fields of practice, and actually integrating these disciplines together to attempt to address that problem and to come up with a solution. And then perhaps even moving further through that into a sort of transdisciplinary approach where disciplines are both integrated. We have this new field of practice integrating all of the scientific disciplines, but we also work externally with other stakeholders. So whether that's industry, government, other disciplines or fields, thinking about things like design as well. Moving on, I spoke a little bit last time about our work in EPIC and how we work at the science policy interface between scientists and policymakers. And some of the work we're doing here is looking at the role of policy briefs, specifically these sort of snapshot documents summarising a scientific output and the policy relevance of that. So I've taken a few quotes from this ongoing work that I think might be interesting and just highlight some of the practical challenges and issues of this working at this area. So these are quotes all from policymakers who were interviewed as part of this ongoing work. I'll start with the first one. The policymaker isn't necessarily interested in the things that are good to know. They want to focus on what needs to be done. So that emphasis on action rather than information for its own sake. The second one, from a policymaker's point of view, the starting point for them making policy is the scientific basis for it, but they have a whole lot of other economic and social, political and legal factors that have to be used to derive the final policy. So again, bringing in that point that while the scientific information is a good starting point, it's a very important foundation, there are many other considerations that come into play. The next quote is, in the policy role, there's the trust in the people who were the authors and did the research for the reports, and there's the distrust by members of the public and the people out there. What you find is you take an action in policy and then members of the public come back and say, but where's the evidence? Why are you doing this? So just touching on this hugely important theme of trust, of having that trust between scientists and policymakers, but also then perhaps this distrust by external stakeholders and particularly members of the public. And I think we've probably all seen this, how this plays out during the COVID-19 pandemic. And I have to say, I haven't really considered that I haven't looked in this presentation at that communication externally to members of the public, but that's another hugely important area, a whole topic in its own right. And finally, the more information that scientists have of policy and vice versa, then the more intelligent the conversation is. So emphasising that this is a two-way discussion, a conversation. It's not just a case of scientists feeding information into policy and that being the end of it. It's more about this kind of ongoing dialogue. Moving on then to One Health. So I think given that we are the International Coronavirus Network and coronaviruses are a fantastic example of a One Health challenge. Most of the coronaviruses that we look at, we deal with, certainly the ones that are of pandemic potential and concern, are zoonotic, so they are transmitted between humans and animals. And in most cases, we've seen these arise from a wildlife reservoir. And I think this is a particularly interesting area. So I suspect most of you are familiar with the sort of One Health paradigm. You've seen this Venn diagram before, that it's the intersection of human, animal, and environmental health. And I think the wildlife aspect is particularly interesting because while in many ways that sits within the animal silo, are wildlife, are they purely animals? When we talk about animals, often we're focused more on captive animals, animals that we keep for companionship or for food. And where exactly do we fit wildlife health into this? Is this something that we're concerned about in its own right, or is it just this very sort of anthropocentric approach, are concerned about the spillover of disease from wildlife, either to animals that people keep and use, or ultimately to impact on human health? And again, we have these kind of multiple layers of communication challenges, that we have the One Health I hate to say silos, but I think often practically that is the case. Going back to within science, the way that we fund and conduct research in human and animal and environmental health is often quite separate in terms of the way that research organisations are set up, in terms of the way that this type of research is funded. We see the same in policy as well. The way that these different areas of health are governed, again, are often separate departments, organisations, and bringing those together in the event of a crisis such as COVID-19 can be very challenging. And finally, moving to practice as well. So the way that we practice, say, human and veterinary medicine is entirely separate. They're entirely separate systems. When something happens and we need to bring these together, again, is that communication network, is that trust already in place? And I say about it's not just about sharing scientific information, but also about sharing experiences, ways of working together, things that might have worked. There were some great examples during the pandemic of, for example, veterinary laboratories stepping up and supporting diagnostic capacity for human diagnostics for COVID-19. And similarly, veterinary practices offering oxygen where they had those facilities, they were able to offer that for human healthcare. So drawing on this, just a couple of common challenges, some of the, whatever the boundary may be, what is it that makes it so difficult to communicate across these boundaries? And I'd say that a big one is language. This comes up repeatedly, that just different groups speak a different language. There's a different culture, there are different abbreviations, different jargon, shorthand, and being aware of that. And in many cases, having translators, people who are able to sort of cross these boundaries and speak both languages can be very helpful. Trust is another one. I've touched on that, but building those trusted relationships and ensuring that key people within each of these different areas are able to call each other, to get in touch, that trust is already in place as part of preparedness for disease outbreaks, not just that when something major happens, that needs to be built from the ground up. Establishing the priorities of different groups, I think, as well, is really crucial. Understanding that different groups do have different priorities, but trying to look for commonalities in those as well. And then finally, something that I think is worth emphasising is that a lot of the communication in this area is around risk, and just recognising that universally that is quite a challenging thing to communicate, and perhaps looking for ways that can be ways that's worked for different groups. So a couple of thoughts about how we overcome this. What might be some useful approaches to try to overcome these communication barriers? And what I would say is research, is understanding that this is a topic worthy of attention in its own right, to try to understand how to do this as effectively as possible. And as is often the case, I think this happens much more in human medicine, that there is that body of evidence which is much more well established than in, say, veterinary or environmental health, just I think because of primarily funding priorities. Similarly, education and training, making sure that professionals working in this area are aware of effective communication strategies. There are people with these skills. So currently at the University of Edinburgh, we are developing a course in this area. We're aiming to deliver that next year. Networking as well, as I say, things like ICN are a fantastic opportunity. Certainly my experience has been that it's been a really great way to bring together scientists from different disciplines, different countries, different areas, to have really productive conversations, and also to build that trust that we spoke about. And as well, engaging with communications experts, as scientists, bringing in people who have expertise in this area and valuing that and drawing on that can be really important. That's certainly something that we do within EPIC. And finally, as I say, although different groups have different priorities, it's about looking for that commonality. What's the shared goal? And I think in the event of a crisis such as a pandemic, there's a very often quite a clear goal at the centre of that, which I think can bring groups together and help to break down these barriers. So many thanks for your attention. That's been a great opportunity to speak to you. And I'd like to pose a couple of questions, perhaps for a little bit of follow-on discussion. So one is, in drawing from your own experiences, are there other boundaries that you're aware of that you've experienced where that communication has been quite challenging? And what strategies have you come across to overcome them? I'd be really interested to hear from participants today. So thank you very much.
Lovely. Excuse me. Thank you, Katie. I wonder if I could ask a favour. I know it's very early on a Monday morning, but for those people online who feel comfortable to turn their videos on, so we could maybe favour just some informal discussions now with Lukas and Katie. Feel free to keep your videos off. don't want to, but I just thought it might help with the discussion points. So does anyone have any questions for the two panelists straight away? I mean, I've got a few to start things going, and Katie obviously and Lucas raised some things for discussion there as well. But does anyone want to start with a comment or a question? Maybe I can take this opportunity. So I had a sort of had a few questions actually. I thought it'd be interesting to get your opinion on. I mean, because I've thought a lot about this, having worked on COVID as well. So maybe I can get the conversation going. But Lucas, one thing I was interested in was this idea about like losing institutional knowledge from one pandemic to the next. You know, this idea that you know, at the start of COVID, it seemed for many people that we were starting from scratch almost with a pandemic response plan, and that seemed to be like for me something that a historian working in that space would be able to respond almost better than a sort of a pure modeler, let's say. I wonder what your thoughts on that are, because often there's, you know, almost like a generation of between these things, and a lot of knowledge can be lost from organizations, especially at, you know, I guess decision making level. So have you got any thoughts on that?
Lots of, but I think the an interesting aspect of that is the kind of I think is that before the pandemic, it wasn't like we didn't have any precedents. It wasn't like it used to be in the early 80s, because I've just went there with the paper, and things where I think by and large, and specifically before, or late 70s rather than early 80s, specifically before HIV came along, I think there was a general consensus back then that the age of infectious disease is by and large over. But in the early 2000s and throughout 2000s, I think we all kind of like understood that we are kind of in the age of emerging infections. There was SARS, there were a couple of pretty scary influenza outbreaks. And so there was a lot of precedence to have a form of preparedness that would work. And then I think what then, I don't know if people might recall this, it was something that was particularly popular in the first months of the pandemic, this kind of almost like a form of irony that was often cited, is that those countries who were, according to the International Prepared Index, best prepared for emerging infection, by and large did the worst in containing the coronavirus pandemic in their own countries. And I think this is where we should look at precisely of what was preparedness understood to be, what kind of idea was preparedness rested on. And I think it was largely rested on a form of technological capability to engage with certain forms of infection. But there was very little engagement with the kind of question of how do we actually develop capacity to deal with uncertain developments? How do we develop capacity to engage and develop trust where there isn't any trust? And trust is one, as Katie just wonderfully explained in her talk, one of the key currencies for any kind of epidemic crisis, and to get enough buy-in and to get enough support from the public and from policy to develop a form of coordinated response. And how do these kind of like more fleeting values of preparedness can become essential elements of preparedness frameworks in the future, I think is one of those questions where I would argue historians are pretty well equipped, certainly not the only ones, but pretty well equipped to provide some kind of idea how that has worked in the past and where it didn't have worked.
Yeah. Thank you. It seems very interesting. I wonder how do you envisage it could improve? You know, I mean, from what we've learned in response to COVID, what are the sort of couple of lessons that we could change in that pandemic prepare? I mean, we talk a lot about pandemic preparedness plans. How do we better hard bake institutional like learning into like a plan that's, I mean, okay, best case scenario, maybe we wait 50 years for another pandemic of COVID size, right? But how is that knowledge that we've learned now going to be baked into the response in 50 years? Is that a big problem, or do you see it as an opportunity?
I think there is a number of issues that one could do, or a number of things that could be done that are currently not being done. And I think one is to take the challenge serious, that it's not just about technological readiness. And if I look at the landscape and where the funding goes, how the kind of reaction to COVID is developing on a global level, you'll see the WHO hub in Berlin being set up for kind of new pandemic surveillance or pandemic intelligence infrastructure. Then, from my perspective, I'm tempted to become quite cynical around this, because it is an extremely narrowly conceived instrument of technological surveillance that is being advanced there with very little transparency, which is a huge problem there. Very, very little transparency and very, very little appetite. And we tried very, very hard, particularly when the hub was set up in the beginning, very little appetite to engage in a conversation with the wider field beyond the data scientists, beyond the kind of modeling epidemiologists, beyond the policymakers who are interested in a very streamlined connection between modelers and policy. Very, very little interest to actually engage in that conversation openly and productively. And I think that is a hugely missed chance, because when it comes to developing a framework of, let's say, pandemic intelligence, it's actually a really interesting framework where we can look at the past and understand what that has meant, where it has been successfully implemented. We can go back to the roots in the United States and epidemic intelligence developed by Alexander Langmuir, for the CDC in the 1950s, was by and large to train epidemiologists to become better equipped with anthropological and ethnographic methods. And that is completely lost in the discussion today. There's a certain hubris that we don't need that kind of engagement, that kind of understanding anymore, of understanding communities, understanding what it means to be within communities, understanding what it means to develop trust between local communities and the epidemiologist or the medical officer who's doing certain forms of analysis and who is understanding how outbreaks develop and what might be done to contain outbreaks, and to bring that kind of local knowledge then into a coordinated engagement with more meta level data analytics, was what epidemic intelligence meant back then. And now we see a kind of like a complete disavowalment of the local knowledge, of the local intelligence, of the local kind of like conundrums. And my worry is that the more we invest in those kind of global overarching data surveillance infrastructures, the more we risk to lose the number one currency, and that is and remains trust. There is, I think, a number of examples and a number of scenarios that we can play through in which it becomes very quickly obvious that whatever the next disease might be, whatever the next pandemic crisis might be, if it comes to challenge some very important values of how society is organized today, we will be in a very difficult position to develop the kind of trust that people will give up on certain aspects of their life in support of a coordinated, reasonable response against the pandemic. Therefore, again, the question is how to develop that kind of trust, and I see very little discussion on that. Sorry, it was a long answer, but
no, it's fine.
It's a complicated topic, and certainly not all that can be said about that.
Katie, that sounds a lot like the sort of siloed disciplinarity that you were talking about in your introduction. I just wondered, like, I mean, when you were talking about the transdisciplinarity, I mean, someone like, I guess from my perspective, a little bit more as a molecular virologist, maybe a bit naive in the policy making side of things. I mean, we have minimal involvement, but it seemed to me that the transdisciplinarity that you were describing might describe something like SAGE or NerveTag or one of these bodies that pulls together experts across different disciplines. Is that fair, or do you think that because they're more like governmental in their origin, they don't perhaps have the same academic focus that a purely academic transdisciplinary consortium might have? I wonder what your thoughts on that might be.
I think if it's not too simplistic an answer, there's a need for both for that deeper work for the people within the very kind of specific disciplinary areas within academia to do that deeper research to really get to the detail of things. But it's then sort of filtering that up, and that's where the need for, as you say, these transdisciplinary committees, organizations, whatever it may be, where that comes together. So there's a lot of talk. I mean, there's a lot of talk about T-shaped researchers. So not all researchers will work across disciplines, but some will, and those are the links there. And I think very much the same, say, between science and policy as well. So when I spoke previously about the work we do in EPIC, we have knowledge brokers situated at that intersection between science and policy. So they have a foot in both camps. And I think there are a lot of examples of that, and recognizing that both roles are equally important. They're just different, that sort of breadth versus depth, and the need to integrate those, if that answers the question.
Yeah, no, I mean, it's just like, as you were talking, it was how a transdisciplinary governmental sort of advisory board might compare to an academic one, I suppose. I don't know if you have any other questions on the floor, James.
Yeah, thanks. And I've really enjoyed both of the talks today. I thought they were hugely insightful and something very different from what we often hear in a virology-driven network. So thank you both very much. I thought there were two really interesting points. I was going to pick up on 2 points that Lukas made, but I've been interested in your views of both of them. So one of the things that Lukas, I think, said earlier in his talk was that, which I think is a really interesting point, that a lot of the policy-related scientific work is about reducing uncertainty. And actually, one of the really useful things about, I call it historical epidemiology, is the fact that it's drawing out some of the uncertainties and emphasizing them. And I think that's a really interesting point, because much of the time we do look to try and reduce uncertainty to improve our understanding, but actually, then moving on to the point that Lukas then made about the work that Alex Langwood did when effectively he set up CDC and the Epidemic Intelligence Network. He's a really interesting man who did a lot of really important work. But I think that the epidemic intelligence work that we do nowadays is often where we're claiming to have more and more understanding of the world around us and of emerging diseases and so on. And that follows on from that we're better at diagnosing them and quicker at diagnosing them, and then we're going to be able to get on top of things properly. But I felt that chimed to a lot of the work that colleagues of mine, Emma Glennon and Freya Jeff, could have done here on the kind of interface between the social science and the epidemic approach, looking at the uncertainty around Ebola diagnoses. So there's often we think that we must be able to diagnose Ebola because everyone knows it, everyone's frightened about it, and what their work demonstrated was, in the context of things like health-seeking behaviour and so on, quantitatively we're not diagnosing 90% of Ebola spillover events. We only diagnose them where there's an outbreak, and actually it struck me, and the draft pandemic treaty, I think, is a really good example of this, that there's a sort of claim that, we're going to get on top of this and technology is the answer to everything. And I'm sitting there thinking, well, the next one's going to get us and you're not doing anything about preventing it. And I wonder whether we can actually use the, I think, clear evidence, which is usually overlooked or ignored, around massive uncertainty about emerging diseases, can be used to actually do much more to frame how societies globally should be responding to these things, and stop kidding ourselves that we can do these things by sitting down in Geneva or a big city somewhere else and saying, well, we've got a pandemic treaty, all of our problems have gone away. Because I'm really worried that we're kidding ourselves massively at the moment, and that the way that we might try and reduce the uncertainty in policymakers' minds through adding science to them actually is just a false reassurance. So a rather rambling question, sorry, but I'm really interested in your views on that, both of you.
I think this is very spot on. I think that is precisely what I tried to convey in some sense, but it's that kind of, it's not only that the idea of the technological fix for something as complex and unwieldy and contingent as a pandemic is a questionable endeavor. And that's not to say that technical innovation is not important. It's absolutely essential, important to develop better tools. And the vaccines and the vaccine development was an absolute astonishing element of the COVID story. You know? But the risk really is that kind of technological fix idea becomes a kind of smokescreen to not do what's required, and that I think will always lead back. And in that way, I think I might be quite old school, but it always leads back to the questions of health equity. And health equity as one of the kind of like crucial foundations upon which any kind of pandemic preparedness activity is much better equipped to actually produce positive results and to produce kind of like the least risky, the least kind of like devastating results. I think for that, for example, Sweden is a very good example. And that kind of like a form of health equity that is cherished, that is established, but that's also kind of considered by those who have been in charge. And I know it's a controversial issue getting to Sweden and everything, but by those who've been in charge in Sweden is kind of like one of the procedures and principles that was not kind of like put away at the beginning of the pandemic, but was something that was maintained at the heart of it. How can this pandemic also be challenged with regards to the inequities that are still kind of like rampant in society, even as developed and as kind of like equitable as Sweden might be, and what are the kind of the issues that might arise from that? But I think to get to the point of uncertainties, I think that is a really the kind of the interesting point where we also, I think, have a chance to bring the kind of uncertainty and I guess historians often speak about contingency of the historical record. The Ebola example is a fantastic example. There's a lot more that we can find. There's some fascinating work, for example, currently going on around the kind of prevalence of Kaposi sarcoma in mid-century African countries. And of course, the big question in the background there is to what extent can we attribute this to the circulation of HIV in places where we've never really understood HIV to have circulated to that extent? What kind of extrapolation can we make? How does that shift the whole record of how HIV might have had contributed also to the economic development of many of the African countries at that point, and so on and so on? There's enormous questions that come into the historical record again at any given point in new ways, shifting and changing how we might conceive and think of that history, and how we might attribute the epidemic and any epidemic as a kind of engine driving historical developments. And that's not a fixed record. But as you said, like, how do we develop an understanding of that uncertainty that allows us to develop policy advice, that allows us to develop an engagement with ongoing crisis without pretending that the uncertainty is gone, is challenging. But I think it might also be a chance where actually modeling provides us with a lot of really interesting tools, and where the modelers and the mathematical approaches are really fascinating in the way of engaging and producing a form of navigation through uncertainty. I just wish it would be better framed or more openly framed as the kind of uncertain grappling with the limited amount of data that we have that it is, rather than to produce reliable instrument of guiding policy through worst case scenarios after worst case scenario. And so there, I think there's a lot that can be done. But I think that's, again, pushing it over also to Katie, and the point of how that relies on forms of multidisciplinary cooperation that we hope to improve. Yeah.
I think if I can follow on from that, I have sort of two takes on this, one somewhat more theoretical and one fairly practical. And I would say a huge part of it is about how we value different types of knowledge, and that, you know, a data set, a quantitative data set, a mathematical model is, I would say, sort of culturally, probably both within the scientific and the policy community, seen as more robust, more valuable, more trustworthy. I think following on from Lukas's point about that, you know, that sort of supremacy of that approach almost. And I think changing that is very challenging. It's almost a cultural shift that's needed to value that tacit knowledge, that contextual knowledge. It's practically as well, I think in many ways, it's hard enough with the systems where we're dealing with spreadsheets to be able to share that knowledge effectively and communicate it and use it. And finding a way to do that with more qualitative information, I would say, is an ongoing process and challenge. And certainly, you know, I think anyone else here may have had the experience of being the only social scientist in the room at many of these conversations. And it just, again, it's a different language, it's a different way of thinking about things, it's an entirely different paradigm in many cases. And actually emphasizing the value of that is hugely important, but hugely challenging, I would say. From a slightly more practical point of view, just going back to that question of uncertainty, something that we do in EPIC that might be of interest is that when we are communicating outputs, we specifically have, you know, we have templates that we work with that go to government. They know the format, they know how they work with, and I'm sure other organisations do something very similar. But we specifically have a column of, you know, the uncertainty level for the evidence that we're providing based on, and also we separate out sort of uncertainty versus variability. So it's how good is the evidence, and also how much does it just depend on the circumstances?
No, thank you both. That's really interesting. And yeah, Katie, I'm sure that more and more agencies that are advising government have to provide an uncertainty statement with their advice, which is a really important step forward. And I think builds on some of the concepts that Lukas has been talking about. No, thank you both for your answers and your talks.
Katie, I wonder if we, excuse me, I wonder if we might finish by talking a little bit about trust. I know it's both you and Lukas mentioned it, and it's obviously a huge topic about how to build trust between science and policymakers and the populace, and science and the general public. One thing I was thinking when you were talking was I mean, it seems society now is very set up to respond very well to individuals rather than sort of organizations. You know, it's a lot about, I mean, I use the phrase very carefully, but sort of more like a celebrity culture kind of style of receiving information. We want to know the person, and I just wonder how you envisage science being able to kind of respond to that, because it's often not our strength, let's say, to be, you know, across all of this, the spectrum, right? I think we're often maybe tucked away doing our experiments or doing our research, right? That we're not maybe as well represented as we could be in the more public sphere. You know, what are the best platforms for us to use to be able to make these sort of discussions more open, you know, to build reputation of people? Or do you think that's not needed? Would you rather see a more institutional driven communication of information about sort of preparedness and prevention? I just wonder your thoughts on that.
If I can answer that, my off the top of my head thought is that perhaps it's something we need to embrace, that we perhaps as a scientific community feel that there's an appropriate way of communicating information, when actually maybe a more, I don't know, celebrity driven is quite the right thing, but accepting that that is how messages are received more effectively. I'm just thinking of the example of sort of Bill Gates was at a TED talk where he spoke about pandemic preparedness, and when COVID hit, people were saying, "Oh, Bill Gates spoke about this years ago," and this wasn't Bill Gates' work. Clearly, he had been speaking to epidemiologists and people working in this field, but that was what caught the attention. And maybe there's an element of trust there as well. This is a known figure. This is somebody that people are familiar with. They're clearly, perceived as very, very intelligent, very successful, and so what they have to say is valuable. So maybe it's, as I say, with the sort of breadth versus depth in scientists, maybe there are the communicators and the scientists. Maybe it doesn't have to be the same person, but it's about finding ways that work and thinking outside the box a little bit on that.
Yeah, I mean, I often think sometimes with the work we do, it becomes so detailed. And the papers we write are so full of jargon. They're meant for other scientists to interpret, right? And maybe we forget about the general public a lot. And I was surprised during the pandemic, some of the work we did, in essence, you could take 6 months worth of work and summarize it for the general public in 2 or 3 lines, right? And previously, that's not something we ever really did, right? You just sort of do it, and then you hope that it has this impact over a long period. But then for some of the more public health driven stuff we were doing, it was getting summarized like that for like JCVI or something, like this vaccine works this well in this group of people. But yeah, I feel like, just going back to this sort of quote unquote celebrity sort of style of things, I remember early in the pandemic, there was a lot of effort trying to get, unrelated non-science celebrities to try and endorse the messages about lockdown and, try and support the sort of country's response. But at that time there are not well-known scientists really. I mean, a few became well-known over that sort of 6 month to a year period, and some of them I'm sure would prefer to remain unknown, right? I mean, it's a double-edged sword to become famous in that sphere, right? Because there's a lot of interrogation then. But yeah, I mean, it's it's an interesting quandary about how to best get that, because I think for me it feels like there's a lot of people willing to sow, a lot of individuals willing to sow untrust, to destruct the balance and especially on like social media. But I think there's less people willing to sort of step up and try and keep those ties and keep that trust in a more stable place. But Lukas, I don't know if you wanted to come in on that as well.
I think I just want to make a general pledge for history again for that, because there's I think there has been a lot of talk in particular around COVID to the kind of rather rampant level of misinformation, a form of kind of anti-vaxxers developing out of this, and a range of kind of, I think also particular attention to, especially with regards to kind of the celebrity-focused social media global landscape, the kind of potential damage that any celebrity can do by coming out as an anti-vaxxer, and how that is becoming like increasingly worrisome to many of the policies we do. But from a historical point of view, that's not unique to COVID at all, but rather kind of a conflict that we see, especially in modernity, all the way back to the mid-19th century. In almost any kind of outbreak, we have these forms of kind of resistance that often kind of tend to focalize on the most unexpected, most unusual things that leave those working at the epidemic front lines, or at the kind of front lines trying to contain this epidemic crisis, absolutely flabbergasted. Like there's the history is littered with those kind of examples, and I think it's something that I where I find it very difficult. It's one of those moments where I find it extremely difficult to articulate as a kind of lesson or a form of how to do that better. I think it's more a kind of question of really developing a better attention or a better kind of expectation to this phenomena to be developing, that while we can develop certain forms of trust, while we can try to use certain recipes to improve the trust of the public with regards to science, policy, I think, is one level here. How does policy characterize science? How is the scientific landscape valued through the policy, through media frameworks within a society? I think there are a lot of questions to ask around that, and there's potentially also a lot of improvement that could be developed around that. But on the other hand, it's also developing a certain form of expectation that will always run the risk of losing some segments of society. And how do we deal with that? How do you incorporate that, rather than to be shocked and flabbergasted by the kind of like loss of trust? Is what are the instruments you can develop to kind of bring them back on board? What are the instruments to create a kind of inclusive framework that doesn't leave people behind, even though they might temporarily think that you are the devil or pronounced evil? And I think that is a really one of those really interesting questions that I would love to see more discussed at this point, because I think COVID also has a lot of example how that very successfully worked, especially in local context, that have not seen as enough light for this.
Thank you. Katie, we did have a question actually, which I think is probably for you on the chat there. I don't know if you've read it, but just wondering about the screening domestic pets this is from Hazel Stewart. Wondering about screening domestic pets for any particular infectious diseases. She's heard a few opinions lately that either they're the reservoir for the next pandemic, or screening or testing is merely a commercial venture and is a waste of real money. Are there any particular pathogens you'd like to see testing being conducted for in pets as opposed to domestic or commercial animals? I don't know if you have any thoughts on.
Yeah, an interesting question. Probably a little bit off topic for this network, but I think antimicrobial resistance is probably an interesting one for domestic animals, just because we have such close contact with our pets, and that as a potential reservoir of resistance would be a really interesting area. I think there are probably people working on this. I'm aware that there are people working on this already, but that would be my sort of top concern probably in terms of surveillance.
Okay, well, thank you both. That was really interesting. I really enjoyed that discussion. And I think it got us off to a very thoughtful start to the week. So I hope everyone has a nice week, and we'll catch you at the next UK-ICN webinar. Okay, take care, everyone. Bye.
Thank you.
Thanks, everyone. Bye.